So now we're going to get this patient, she is a left CVA with right-sided weakness. We're going to get this person to the chair. Now, for the purposes of your practical, you probably want to get the chair set up before you actually get them into the sitting position, okay? You don't want to get a patient up and your chair and your setup is elsewhere, okay? Because a couple things can happen. Number one, you're going to leave your patient and they're going to fall, okay? Or number two, you realize this and you say, ma'am, I have to lie you back down because I have to get your chair set up. And so then you have to get them back into bed, okay? So have your room set up before you move your patient, okay? So we're actually gonna put this chair, we have this IV. Much of this takes pre-planning. You have to think, which way do I want to transfer my patient and how am I going to do that, okay? So again, I'm gonna get this out of the way because it can't be back there if I'm going to put the chair there to transfer into, okay? So we do have this across her body for just a second. And maybe I have an aide there kind of guarding her. Or I would just leave her in the supine position. So I'm gonna put my transfer chair right here. Okay. I have my seat covered. Ideally too, we always want to make sure on their feet we have the grip socks, okay? These other socks can be kind of slick on these floors, so we always want something with the grip, okay? So, again, I don't want to leave this IV pole right here because in the transfer, this could get tangled, it could get ugly, so I'm actually going to move this over here, okay? Now, how far I move away from my patient as I'm rearranging the room depends on my comfort level and how they're doing sitting. If my patient is sitting here like this, I know my reaction times so that I'm paying attention to her moving things. And if I see her start to lean either way, I'm right there to kind of catch her, okay? You have to know and be able to see what your patient is doing and what you need to do with moving the IV and stuff. We can see her arm is was kind of behind her. That's something I should have got out a lot sooner than right now, okay? So when you're doing a squat pivot transfer to the chair, we don't necessarily need this person to come to a full standing position because normal movement going from chair to chair is kind of a squat pivot, okay? So we have this kind of as close as we can to the bed. The brakes are on, okay? So one of the first things that we do is we make sure we have this leg in a good position for them to kind of pivot on. This leg is a flaccid extremity, so we want them to transfer away from that extremity so it doesn't get tangled underneath them. We always want them to transfer, I say always, it depends though, we usually want them to transfer to the stronger side, okay? So we're transferring to the stronger side. Do we want the patient to look at the chair or away from the chair? We want them to look away from the chair. When they look away from the chair, their bottom automatically kind of moves in that direction, and that's exactly what they want, okay? So with this, we want the head turned the other way. You can have this patient use their arm. I want you to push up from this arm, and when you push up here, you can push up here and then reach for this armrest over here. So try to push up. Oh, sorry. You know what? Let's just put it right over here, okay? So you're going to stand up on this leg and do this transfer over, okay? So what did I do with this? I realized I didn't want to put her arm here to transfer because then she would have kind of been stuck in a kind of semi-standing position. I thought that it was best for her to reach this arm over for this armrest. While she was completing that transfer, I had my knee right at her knee to prevent any kind of buckling. That's that force couple that you guys learned, okay? I'm making sure she can do the transfer. I'm guiding her through it, but I'm letting her do as much as we can.